Money. Oh wow. What the hell is this? Oh, what the hell? Ah, Jesus Christ. What the hell? Damn, my car is destroyed. What the hell? Oh my god. So crazy. They're all destroyed? They all destroyed, guys. Anyway. Mhm. Okay. What is that? Where is it? Where is it? Oh, there you go. Alright, first thing first. I need some new clothes. Anyway, so I need some clothes. Um, it's the only clothes store I got. Oh wow. This is asking me to. I don't know. Special T-shirt. What's this special T-shirt? I will see what kind of T-shirt. Damn, it's not bad. I like the first one, I guess. They do got polos. Thought they didn't. Okay. Alright. Here we go. So it's not the. Alright, I find Alright, let's find you a top bottom jeans. Boy, damn. Ah, wow. Excuse me, guys. Just say you don't think it can help you in our relationship. That's what you said, right? That's what you said, right? You said I want in our relationship, right?
Yeah. Yeah, look at you.
You said you can't look at me.
Uh-huh.
Why if I look at me? See, I met VJ takes me for credit. I thought everybody else have VJ account. Like, we can't talk and you know call VJ. can't even look on it. Uh, yeah, sure.
Yeah, I hear.
I say where you eat me, I can't even look on it. True.
Time heals.
If I don't want, no way to eat. I'm gonna take some. Some.
Hello. Hi, how are you? Okay, how are you doing? Good, good, good. When do you go to Portland? Oh my God. Okay. Oh, I thought you had a specific day during the week that you go. Oh, not the week. Okay, no problem. That's what I wanted to find out. All right, thanks. Mhm. For 2 weeks from a business long.
What you want to put on?
Hmm?
What you want to put on? Huh?
Yeah.
What you need to put on?
If we drop off here.
You can drop off a put on.
Windsor. Yeah, Windsor Castle.
Where you hear it come from?
Derek. Tomorrow.
This money for meet Derek. For
They can pick up ID from go get Derek that time. They can pick up your ID.
this money
If
live
you know
out. This money live out Windsor, so Derek can miss money and not of it.
you can, but you don't know you kind of, you know, your feelings already about my money. I know you never deposit the money.
So yeah, then they sort out the money.
The girl went to his house pick up some of them, but they never give her the phone and stuff. We never give her something. I said I couldn't find him, so this morning we go on the phone with him and he find him. You know, ever look like I'm like him blind. Time I tell me say he not see. I mean, if I tell him, say, just send me a picture where you have and I guess me can help you pick out it. But there some of them are there, but him not see them.
In blind.
It look like you know, Jamaican like not really. Come notice that when they go home in the mess, but you can't see nothing nice over there. And this was so used to foreign light. In Jamaica just look dark.
So can be that real.
Yeah, like when I room me just stay, I felt like it was dark. And the big bright lights, not yeah. So yeah. But they leave from Portmore and go to Portland, so that's why I made her just use she. Because she pick up with something on my phone for me, so I just.
So me like ask my sister and brother all the time, but since I say
It's not that serious.
I said Ricky have to jacket Portland.
You know, they still don't forget to run Derek, so it makes no sense.
Eh?
When they still don't forget to run Derek.
True.
And they say drive, why not put front that way there?
The boy was it trying.
Oh, if you want to put front seat there, then drive, do that easy. Easier.
Rocks. Yeah, doctor. Rocks. I don't listen. Alright, I guess I'm going to finish because this is all. Let me go on my Thank you for watching, guys. Need something. Need some money. Need some money, guys. Money, 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 money. Hey, what's up? I'm good. I'm good. How are you? Are you okay? Oh yeah, I did. That's why I'm here today. See if I can make up for it. Are you okay though? I'll take my time. I guess I'll try this one on my own. I don't have a choice. Do I have a choice? Try this one on my own. All right. Alright, so I guess I did help my friend with this one, but because I was in his world, so fortunately I have to do this on my own. But let's see if I can do it on my own, anyways. I don't know.
Sodium will be less than 20 per liter of blood, but they're actually only filtering 0.12 liters of blood. Right. The heart supplies blood to the kidney, and as you could probably recall from your nephrology teacher,
Get up! Get up, bro.
Here we have the heart, and here we have the kidney. It's actually kind of cool seeing them side by side like this. They're actually the same height, about 5 inches tall. But that's not why I brought them both here. The reason why I brought them both here is to make the following. The heart supplies blood to the kidney. And as you could probably recall from your nephrology teacher, yes, indeed, the kidney gets 20% of cardiac output, meaning the heart pumps out 5 liters of blood every minute. The kidneys get one of those liters. But this does not mean that GFR is a liter a minute. The nephrons are, of course, not filtering a liter a minute of blood. This merely means that the kidneys are supplying a liter of blood, but they're actually only filtering 0.12 liters of blood a minute, or 120 milliliters of blood a minute. This is what GFR is. I hope we didn't insult our nephrology teacher with this information. Let's tell him 2 nephrology jokes to make him happy. What do nephrologists say to non-compliant patients? You're in trouble. What happens to nephrologists who smoke marijuana? They get kidney stone. With that introduction, let us begin with acute kidney injury. Question 1. A 72-year-old lady is breastfeeding. Her lethargy and reduced appetite a few days after a urine URI. Here are her lab values. Urine sodium will be less than 20 or more than 20. But let's take a look at the important lab values. Lethargy, temperature, and hypotension. Even lethargy and temperature equals sepsis. And what happens in sepsis? Reduced perfusion to the kidney.
Shit.
That's a consequence of sepsis. And when there's reduced perfusion to the kidneys, has a pre-renal AKI state, and therefore sodium will be less than 20. And let's explain why. In pre-renal AKI, the urine sodium is less than 20 because the kidneys recognize the reduced perfusion, activating the renin-angiotensin-aldosterone system. Then aldosterone acts to increase serum sodium, thereby decreasing urinary sodium. So again, in prerenal AKI, aldosterone is released, which leads to increased serum sodium. Now this is really important because in prerenal AKI, the kidneys are able to do this. They're able to retain sodium because the tubules themselves, at least at this point in time, are not damaged. This is in contrast to, as we'll see, intrinsic renal AKI. So again, low perfusion, sodium reabsorbed. What will the osmolality of the urine be? Well, as sodium comes out, water comes along with it, and therefore urine osmolality will actually be high. So urine will have low sodium because sodium is reabsorbed, but it will have high osmolality. Question 2. What will appear in her urine? Again, she has a prerenal AKI, like blood cell casts, body casts, or hyaline casts. So remember, in prerenal AKI, the tubules are intact, and therefore there will not be any pathologic casts. There will be hyaline casts, which are normally seen in the urine, and so she's happy. Red blood cell casts are a sign of glomerular injury. Body casts are a sign of acute tubular necrosis. But hyaline casts are normal. We will name the lady in our scene Harleen because she has hyaline casts. As again, she had a prerenal AKI. They're composed of aggregated TH proteins, which we don't care about. These hyaline casts had to be elevated in a person with a prerenal azotemia. So far, once we have about prerenal azotemia, urine sodium less than 20 because of aldosterone. Urine osmolality high because as sodium comes out, water also comes out. And in the urine, we'll see hyaline casts, which are not necessarily pathologic. Question 3. What is her BUN to creatinine ratio? Again, in her prerenal AKI, more than 20 to 1 or less than 15 to 1. Well, as we recall, there's low perfusion in prerenal AKI, and sodium is reabsorbed. And BUN is also reabsorbed, primarily in the PCT. Creatinine, however, cannot be reabsorbed.
I don't know what I did there.
So BUN is being reabsorbed just like sodium, and creatinine is going out. Therefore, the BUN to creatinine ratio will be elevated. BUN to C, bunk. That's why I like to imagine a bunk bed on her head. Bunk bed for BUN to creatinine. Her name was Harleen because she has hyaline casts, i.e. non-pathologic casts. And in the toilet, there's low urine sodium. So the toilet's happy because he doesn't like salt. In prerenal AKI, sodium is retained. And here is the hippo. I guess Harleen likes hippos. Just kidding. The hippo represents what we're talking about, hypovolemia. And in a hypovolemic state, all these conditions are true. Question 4. What is the treatment for prerenal azotemia? Besides treating the underlying problem, such as antibiotics for pneumonia, crystalloid solution, or amikacin? And the answer is crystalloid solution. Crystalloid solution is just a fancy way of saying saline or lactate breakers. That's what it is. Fluids. Fluids that mimic or closely mimic the body's osmolality. Amikacin, no way, Jose, that's an amino glycoside. That can cause an acute tubular necrosis. That would not treat a prerenal azotemia. Question 5. An 18-year-old woman is in need of pneumonia. Now she has sepsis, she has IV fluids, vasopressin, and antibiotics, such as gentamicin. She is stabilized, but a few days later, serum creatinine is elevated, and your analysis shows epithelial cell casts. Epithelial cell casts are another way of saying muddy casts. and they're a sign that the tubes themselves got damaged. Serum creatinine is, of course, elevated because the nephron is damaged, so it's not doing its job properly. And gentamicin is an aminoglycoside is probably the cause of the nephron damage here, because aminoglycosides can cause nephrogenic acute tubular necrosis. So the tubules got damaged. Remember, there are two types of acute tubular necrosis, such as ischemic, example due to an MI, or nephrogenic causes, such as drugs, aminoglycosides, vancomycin, and ethylene glycol, along with contrast.
Try this one more time.
For the patients to recover from acute tubular necrosis without considering severe complications, the answer is about 2 to 3 weeks. That's how long it takes for the tubular cells to regenerate. And now that we've spoken about acute tubular necrosis, we can compare pre-renal states, which we've spoken about already, with intrarenal states, such as acute tubular necrosis. And the lab values are the exact opposite. Whereas in pre-renal states, urine sodium is low. In intrarenal states, urine sodium is high because the tubes are damaged and they can't absorb sodium anymore. And if we move down, these are the red blood cell casts, the white ones, the muddy ones, and the fat ones. Question 6. A 37-year-old man comes in, blah, 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 and urine shows white blood cell casts. What is the diagnosis? So white blood cell casts are seen in acute interstitial nephritis. Whereas in glomerulonephritis, we see red blood cell casts. In acute tubular necrosis, we see muddy casts, eosinophils, and also down to the urine in acute interstitial nephritis. But they're not always found. Now, the same thing, acute interstitial nephritis, would have been the right answer had the question said, a man comes in with a fever, rash, and kidney injury. What is this? Acute interstitial nephritis. Acute interstitial nephritis is a hypersensitivity reaction which affects the interstitium and the tubules, and it includes the cessation of the drug. Drugs which can cause an acute interstitial nephritis include penicillin, sulfa drugs, haloperidol, phenytoin, quinolones, and NSAIDs. The same drugs which cause Stevens-Johnson syndrome in addition to lamotrigine. And it makes sense. Those conditions cause a type 4 hypersensitivity reaction. How is acute interstitial nephritis diagnosed? Clinically, a kidney biopsy is the gold standard. We just usually don't need it. How is acute interstitial nephritis treated? Stop defending agent. And if there's no response, then we give steroids. So far we've discussed tubular diseases. Now let's talk about glomerular diseases. Nephrotic syndrome, which involves loss of protein, and nephritic syndrome, which primarily involves glomerular inflammation. Question 7. Which value is increased in nephrotic syndrome? Albumin has a thrombin, gamma globulins, or lipids? And the answer is lipids are elevated in nephrotic syndrome. Albumin is lost in the urine. Proteinuria, that's the definition of nephrotic syndrome. More than 3.5 grams a day of protein that's lost. And that's why they get edema, because of low autonomic pressure. Antithrombin 3 actually leads to hypercoagulability. And gamma globulins, those are also lost in the urine. That's why patients with nephrotic syndrome have more protein infections. That's why patients with nephrotic syndrome require pneumococcal vaccinations. Lipids will be elevated. And the reason is because the liver produces lipids and cholesterol in response.
I was trying to run, guys. I was trying to run.
That's why in nephrotic syndrome, patients are more prone to accelerated atherosclerosis because they have so much lipids in their body. They need to be put on statins. Now, how do you minimize proteinuria in nephrotic syndrome? ACE inhibitors. How do you minimize lipids in nephrotic syndrome? Statins. How do you minimize edema in nephrotic syndrome? Diuretics. What cheese is named backwards? Edam cheese.
Yeah.
Right? Because they spell letters backwards. Edam cheese. That's just a joke. Alright. Question 7. Patient with nephrotic syndrome now has flank pain and hematuria. This was most likely caused by flank pain, and hematuria is likely caused by a reduced anticoagulant because now they have a real big thrombosis causing the flank pain and hematuria. Hematuria and red blood cell casts in the urine is a sign of nephritic or nephrotic syndrome. And usually this is associated with nephritic syndrome. Here's acute mnemonic. Nephritic syndrome involves proteinuria, hematuria, azotemia, red blood cell gas, oligoria, and hypertension. And here we just see the differences between nephritic and nephrotic syndrome in a cute little cartoon. Actually, put this Colocan over here. This Colocan reminds us of the cold-colored urine in nephritic syndrome. Question 9. Which type of renal tubular acidosis causes hyperkalemia? 1, 2, 3, or 4? So if you know renal tubular acidosis well, welcome to the club. As for the answer, well, it's not type 3, because there is no type 3. At least not that I'm aware of. It's type 4. Here's a cute little mnemonic from Dirty Medicine. 214 Lola Moore. In type 2 it will be low, in type 1 it will be low, but in type 4, potassium will be elevated. If on test day there's hyperkalemia, you know it's type 4. If on test day there are kidney stones, or the urine pH is elevated, or there's calcium, you know it's type 1. Question. When a person has a low blood volume, for example due to vomiting, what will happen to the nephron efferent arteriole? Well, remember, angiotensin II has various functions. And when a person has a low blood volume, angiotensin II does its job. For example, it constricts the efferent arteriole. So therefore, since we have low blood volume in our question, the arteriole will constrict. Remember, angiotensin I is converted to angiotensin II through ACE. And angiotensin I itself used to be angiotensinogen until Reddit came along. That's what Reddit does. Question 11. Does metformin cause kidney damage? And the answer is no. Metformin does not cause kidney damage. It just increases lactic acidosis. That's why we hold it in hospitalized patients, especially in a patient with renal insufficiency, because we don't want lactic acidosis to build up, which can increase creatinine. And the answer is BPH. Fiber might be able to reduce creatinine, but BPH could lead to an increase in creatinine. Here we see the BPH causing an obstructive neuropathy. This leads to a slow rising creatinine. But if you see a question of a person who has BPH and they have proteinuria, you know it's probably not because of the obstruction, because BPH cannot lead to an increase in proteinuria. Question 10. Not sure we got to question 10. We've already done question 12. But anyway, secondary nocturnal aneurysm in children is usually developmental or due to some cause, and the answer is due to some medical or psychological condition. Remember, primary means since birth, and secondary means they've gone at least 6 months with bladder control. So secondary aneurysm would be due to a medical or psychological condition, whereas primary would be developmental. In both cases, the child is over 5. In both cases, we had a urinalysis to assess, for example, UTI or proteinuria. And remember, newborns are supposed to have at least 1 wet diaper per day of life. So if a neonate has a single wet diaper in the first 2 days of life, we need to get, for example, a renal and bladder ultrasound to assess for any congenital anomalies. Question 11. What is the main cause of death in patients with scleroderma? Renal failure or lung disease? And the answer is lung disease. It used to be renal failure before the 1980s, but now it's lung disease. And what is the mechanism of sclerodermal renal crisis? It occurs due to collagen deposition and endothelial injury in the renal blood vessels. Question 12. Splanchnic vasodilation that leads to kidney injury which does not improve with fluids. This is hepatorenal syndrome, a very life-threatening condition. What is the treatment for hepatorenal syndrome? Well, really, it's liver transplant. But until then, albumin and renal vasoconstrictors, because again, the problem is vasodilation. You can just take a look at my video online of hepatorenal syndrome. Question 13. A 48-year-old woman with a recent UTI, 9 months right-sided plague fever, but no bacteria or red blood cells are found. What is the diagnosis? So this is renal abscess. Remember, renal abscess shows up after UTI with flank pain and fever. We may or may not see bacteriuria or proteinuria. And here we just have a picture of the renal abscess. Question 14. A 47-year-old woman got a renal transplant now has decreased renal function. Her medications include prednisone, tacrolimus, among others. What caused the kidney injury? So remember, tacrolimus or tacrolimus is nephrotoxic, and it causes a pre-renal condition. That is, calcineurin
Welcome, guys.
inhibitors cause
Welcome.
vasoconstriction. The AKI is through a pre-renal mechanism. It's quite interesting. Tacrolimus is used in kidney transplant to prevent rejection, but it's nephrogenic. And note, diuretics such as furosemide also lead to pre-renal azotemia, but through a different mechanism. That is, they lower blood volume, so there's lower cardiac output, so there's lower perfusion to the kidney. Question 15. How does cardiorenal syndrome damage the kidneys? This is not hepatorenal, it's cardiorenal. And cardiorenal syndrome, there's increased central venous pressure, heart failure, leading to volume overload and venous pressure and congestion, damaging the kidneys. Question 16. What is the mechanism of NSAID-induced kidney injury? The NSAIDs lead to either interstitial inflammation, as we mentioned before, in acute interstitial nephritis, but we usually refer to the prostaglandin inhibition. By inhibiting the prostaglandins, which dominate the afferent arteriole, NSAIDs effectively constrict the afferent. And here we just have a comparison of NSAIDs and ACEs and ARBs. Remember, NSAIDs constrict the afferent, and ACE inhibitors effectively dilate the afferent. Question 17. 50% of patients with rhabdo develop acute kidney injury. 50%. That's why we have to check their CK levels. And the mechanism of injury is that myoglobin causes damage to the kidney tubules. Question 18. How to prevent contrast-induced kidney injury? And the answer is not by holding with metformin. Remember, metformin is not nephrogenic. It's by giving contrast with fluid. For example, 0.9% saline. We also want to give the lowest possible dose of contrast possible. Question 19. What study should be done in a patient diagnosed with membranous nephropathy? And the answer is hepatitis B serology, because membranous nephropathy is associated with hepatitis B as well as C. I like this mnemonic I made over here. Another pharaoh. Remember the froggy reminds me of membranous nephropathy. Pharaoh here is really scared because of the froggy. He had been in the middle of putting a deposit near a subway. So subway deposit for sub-epithelial deposit or deposition. And it's associated with Hep B and C because the story of Pharaoh occurred in BC before the year 0. And it's also associated with SLE, malignancies, and NSAIDs.
Huh? Is that it? Come on, what's happening? Why can't get Jesus in AC fix? Guys, my back hurt.